I have the distinct pleasure of introducing our keynote speaker for the commencement, Paul Grogan, who is President and CEO of the Boston Foundation. Paul Grogan is a man with a history of transforming organizations that he leads and pursuing innovative strategies. Under his leadership, the Boston Foundation has moved from being a more quiet grant maker to being more visible and to pursue ambitious research and public policy agendas. The Boston Foundation's sole purpose is enriching the lives of the people of the city of Boston. It is made up of over 900 separate funds established by thousands of donors over the past 90 years. It was the first foundation established to build an endowment to improve the life of its community. With assets of $850 million, it distributed grants of more than $75 million last year to nonprofit organizations. Mr. Grogan graduated with honors in American history from Williams College in 1972 and earned a master's degree in administration from the Harvard Graduate School of Education in 1979. In 1997, Williams College awarded him a bicentennial medal for his leadership in inner-city revitalization efforts. He is a trustee of the John S. and James L. Knight Foundation, a founder and director of the Community Development Trust, a trustee of Brandeis University and the Buckingham Brown and Nichols School, and a former trustee of Williams College. Mr. Grogan's love affair with cities began in Boston, where he served mayors Kevin White and Ray Flynn in a variety of positions. He headed Boston's neighborhood revitalization efforts in the early 1980s, where he helped pioneer a number of public-private ventures that have been imitated by other cities. These include the Boston Housing Partnership, which helps individuals and families find and hold on to affordable housing and promotes family self-sufficiency, and the Boston Compact, the city's historical collaborative school improvement agreement among the mayor, the leaders of Boston's business and higher education communities, the Boston Public Schools, and the Boston Teachers Union. Mr. Grogan joined the Boston Foundation from Harvard University, where he served as Vice President for Government, Community, and Public Affairs from 1991 to 2000. He was also a senior lecturer at the Harvard Business School. Mr. Grogan spurred unprecedented commitments from Harvard to the community, including $21 million for affordable housing and $5 million for the Harvard After School Initiative. He transformed Harvard's previously poor relationship with the city of Boston, paving the way for Harvard to double its property holdings in Allston with the public support of the mayor, local neighborhood groups, and the Boston Globe. Paul Grogan is the author of the book Comeback Cities, which has been called arguably the most important and insightful book on the American city of a generation. Faculty, students, guests, please join me in welcoming our 2010 commencement speaker, Paul Grogan of the Boston Foundation.
Well, thank you, Bob, for that extraordinarily generous introduction. I admit that when you began the program by talking about that this was fulfilling your lifelong ambition to be on a Jumbotron, I was a little bit worried that you were going to break into the gyrations and the weird things that people do when they get on Jumbotrons at Fenway Park or Boston Garden. But you maintained your decorum, which is appropriate for an event like this. Anyway. I loved being here with you. You all look great. I loved Austin's remarks. It's always a high point when the student speaks to us. And the only thing about it, it reminds me of a kind of an unfortunate incident from my life. At my graduation, 40-some years ago, very distant now, I was in a competition to be selected as the student speaker at commencement. I was so confident that I would be selected that I went ahead and wrote my speech. And then they picked the other kid. And I've been brooding about it ever since. But here's the good news. I kept that speech. I have it here with me. And I'm going to deliver it to you right now. And it's only 45 minutes. Just kidding, just kidding. Seriously, congratulations to all the graduates and their families and the faculty and the staff and administration of the Boston University School of Public Health for delivering such a spectacular class to the world, and the world needs you. In choosing public health, you are entering a truly noble profession which has already made immense contributions to mankind and has every opportunity to continue to do so. You will have the priceless satisfaction of doing good, and it doesn't hurt that while the overall economy remains iffy at best, employment opportunities in public health are really quite good. And I'm sure this is welcome news for you parents out there. Yes. You know, it's almost a requirement of commencement speakers that we give advice to the graduating class, but you're all quite mature. You've had a lot of advice already, so I'm not here to give you any advice at all. Instead, I'm here to ask for your help. As the demographic data makes clear, the future of humankind will largely be an urban one. More than half of the world's population already lives in cities, and the percentage will only grow. As Harvard urban economist Ed Glaeser points out in his important book, The Triumph of the City, as desperate as conditions are in many third world urban slums, cities do offer opportunities for mobility not available in the countryside. But he points out that the promise of cities can only be realized if cities become far less dangerous places. And that job internationally largely belongs to you in public health. In other words, the world must reproduce the urban public health successes of the United States and the European industrialized nations. Glaeser writes, quote, "Proximity makes it easier to exchange ideas or goods, but also easier to exchange bacteria. All the world's older cities have suffered the great scourges of urban life, disease, congestion, and crime. The leaps made by European and American cities will likely be repeated in the developing cities of the 21st century, and that will only make the world more urban. Urban growth will be palatable to everyone when cities do a better job of defeating the demons that come with density. The cities of the developing world have yet to win those battles," end quote. This will be the work of many of you who are going to be fanning out across the globe to do your public health work. And though the challenges are daunting, we have done this before, and therefore I believe that we can do it again. But for those of you who intend to stay in the United States, there's a public health challenge here that I'm far less certain we can meet. And if we cannot enlist the public health profession in this fight in a far different and larger way, we are lost. Up to now, public health is not rising to the occasion, and this is what I want to talk to you about this afternoon. The problem can be stated quite simply, and it is certainly familiar to all of you. The United States is paying way too much for health care and getting far too little for it. And there are four principal consequences of this continuing failure. One, the trajectory of rising health care costs is completely unsustainable from a fiscal point of view. Two, these costs are crowding out other necessary investments, particularly in the public sector, in a way that will surely cramp our future. Three, there is a mismatch between the money we are spending and the true determinants of health. And four, we are getting comparatively poor outcomes despite spending all this money. Just how much are we spending? It's really astonishing. Well, of the 34 advanced nations of the so-called OECD, the Organization for Economic Cooperation and Development, the U.S. is in the lead at devoting 17.4% of its gross national product to health, twice the median of the 34 other countries, and nearly half again as much as the second-place country, which is the Netherlands, at 12%. Now, what would it mean if we merely spent at Holland's level, if we could get down to the second-place level? The savings annually would be approximately $775 billion a year. Now, how much money is that? Well, if I had that much today, I could give each of you here $550 million. This money would cover the fiscal 13 budget gaps of all of Americans' states 15 times over. Or we could set up a $50,000 college fund for every child living in poverty today. We could, with those savings, literally buy all the tea in China. We need to acknowledge that our enormous fiscal problems are really a health cost problem. As Mr. Fuchs, an emeritus professor at Stanford University, recently said, if we solve our health care spending, practically all of our fiscal woes go away. If we don't, then almost nothing else we do will solve our fiscal problems. As just one illustration, if we could bend the cost curve by bringing Medicare the growth of Medicare costs down to a rate of only 1% a year more than economic growth, the projected long-term deficit would fall by 1/3. But it's not just the cost per se, it's how the cost is wrecking public sector budgets at all three levels of government. Because medical cost growth so far exceeds economic growth and therefore tax receipts, public officials have no choice but to savagely cut other programs in order to keep paying their employees escalating health care premiums. This phenomenon is somewhat less evident at the federal level because it can print money. But the day of reckoning is coming even there, and state and municipal budgets are already getting hammered. Witness what's happened right here in Massachusetts. In the first 9 years of this century, state spending on health care was up 76%, while public higher education was cut 27%, and other large cuts were levied on infrastructure, the environment, parks and recreation, and so forth. And what about public health over that time? Cut 25%. The same phenomenon is at work at the city level. As the Globe columnist Brian McGrory wrote recently, the city of Boston cut 1,050 jobs in the past 2 years, yet payroll still increased. Why? There are a few small reasons and one big one: healthcare costs. From 2008 to 2011, with markedly fewer workers, the city increased its healthcare spending by more than $40 million a year. The city now spends annually more on healthcare, over $300 million, than it does on policing, at $270 million. In order to pay health care and pension costs, which also grew, we're cutting programs that actually make vital contributions to our prospects for health, as all of you know. For those who remember the first generation of video games, it's like we've unleashed a horde of Pac-Mans that are devouring everything in their path. And it is further and disturbingly a picture of a country that is reducing its investment in the things that will secure a vital and dynamic future. America has always been about a better tomorrow, but this is a picture of a yesterday society. Would that for all this spending and sacrifice of other investments, we were getting great results. We're not. In perhaps the most important measure of a country's health, life expectancy, the U.S. ranks near the bottom of the OECD nations, nearer to Cuba than to leaders like Japan, Italy, and Australia. We're losing out on 5 years of extra life that we should have on average. We also lag on infant mortality, and the U.S. has the highest obesity rate, more than double the average, and 3 times higher than what is found in European nations like France, Italy, and the Netherlands. I mean, you couldn't make this up, could you? The U.S. is bankrupting itself on health care costs, simultaneously destroying our ability to make the needed investments in a better tomorrow, and getting terrible results in the bargain. I mean, who came up with this? Simply stated, we are spending much of this money on the wrong things when we are not wasting it altogether. And you know that many current analysts estimate that up to 1/3 of our medical expenses are either unnecessary or wasted. But that's a speech for another day. The real problem is that we are aiming at the wrong target, creating a huge disconnect between our expenditures and the actual determinants of whether we are healthy. We know from the Centers for Disease Control that fully 50% of our health is determined by behavior, like diet, exercise, and whether we smoke and engage in reckless behavior, while only 10% is determined by access to medical care. Yet virtually all of the money we spend on health in this country goes to medical care. We've forgotten Grandma's admonition about an ounce of prevention, as we spend 100 times more on curing illness than on preventing it. The current situation represents a continuing, monumental national failure with the direst consequences, if not remedied. The Center for Disease Control recently projected that 42% of all Americans will be obese by 2030. Healthcare costs associated with obesity already exceed those associated with tobacco. If we continue our current path of being willing to spend infinitely on medicine but virtually nothing on prevention, the obesity epidemic alone will crush us. It's my thesis today that while the public health profession has not caused this crisis, it cannot be remedied without you. And I don't mean just by your work as individuals, as fine and good as it no doubt will be. What I mean is your profession's role in replacing the failed disease care paradigm with a new prevention and wellness paradigm aligned with the traditional aims of public health. This is your moment to emphatically assert your philosophy and approach, to argue for the efficacy of public health as a critical component of a national solution. The good news, more attention is being paid to cost and the rise of preventable chronic disease. That's particularly true here in Massachusetts because we have succeeded in extending access to health care to virtually everyone. But I don't think public health is really at the table. You're the Rodney Dangerfield of all professions. You don't get no respect. Even as the conversation changes, there's far more focus in the news and elsewhere on things like cutting waste in medicine and alternative payment plans. Who is calling for massive investments in public health? Virtually no one, and government spending on public health continues to be cut as we speak. And this, despite your track record of prodigious accomplishment. American lifespans have increased by 50% in the last century, adding 30 years to life expectancy. And scholars credit public health with 25 of those 30 years, advances in medicine only 5. Great public health campaigns have reduced drunk driving, traffic fatalities, and smoking, vastly improved literacy, housing conditions, and workforce safety. Why are you all so shy about promoting these successes and laying claim to a major role in addressing the alarming situation we are in? Perhaps BU and the other public health schools need to attract a few more PR types as well as idealists who will understand that quietly going about their great work and service is no longer enough. Public health must rebrand and reposition itself in the public sphere, and it must have a voice, a big voice. Maybe it needs a new name, because right now, to the extent it has any image at all, it is vaguely associated with issues only in the third world, not seen as particularly germane to the crisis at home. But there is always opportunity in crisis. The disease care paradigm has had its day, and it has been found terribly wanting. It is no answer for either runaway costs or the rise of preventable chronic disease. Yes, medicine still has the power, the prestige, and most of the resources. But the visionaries in medicine and in public health can come together to fashion the compelling hybrid strategy that will put the best of both worlds to work. That is the urgent work that lies before us, and I urge you to take it up. The late president of the University of Chicago, Robert Maynard Hutchins, once said, "It may take 100 years to create the civilization we want. That's all the more reason to get started this afternoon." Congratulations to the graduates and best wishes.